Hello everyone, I am Dr. Sourav Dhara, a critical care physician by profession. Today I am going to discuss how to detect asthma early and as early as from home. So asthma, as we all know, it's a respiratory disorder where the patient presents with a breathing difficulty, and it is really severe and can be fatal also. It usually presents in the infancy or early childhood, but it can present in the later half of the life also. And to diagnose a case of asthma, other than the investigation, we need something that is history, and it is very much important in diagnosing a case of asthma. And for that, we need a family history also. If the patient's family, patient's siblings, mother, father has previous history of asthma, so there is a high possibility that this patient is also having a asthmatic breathing difficulty. Number two, if the patient himself or herself is having some allergic rhinitis or atopic eczema, dermatitis type of disease, these are also findings that will point that this can be a asthmatic exacerbation. Number three, the frequent exacerbation. These patients usually have a frequent cough and cold, and in between the period the patient will be absolutely fine. Number four, where there are some risk factor or there are some potential triggers that can increase the difficulty in breathing or shortness of breath, and for that we need to have identify the possible risk factor or possible triggers for that particular patient. It can be a house mites, it can be house dust, it can be pollens of flower, it can be even a perfume, it can be even a paint, it can be any type of seasonal change from winter to summer to rainy season to winter. It can be whenever there is a seasonal variation. All this points out that it can be a asthmatic breathing difficulty. It can be when the patients have a pet in his or her house. That pet is also that dust or that mites can also lead to a asthmatic tendency or asthmatic exacerbation. Cigarette smoke, any type of extreme cold environment, all these can lead to asthmatic tendency. So we have to identify this potential trigger, and if possible for those patients we should definitely avoid this. And if we see something like this happening in our day-to-day life or in our neighborhood or in our near and dear one's life, we should advise them to take medical help early so that they can be benefited. Thank you.